Now, Obama may have won the election, but many states are saying not so fast to Obamacare. 20 states and counting have already said pass when it comes to setting up the health insurance exchanges that Obamacare mandates. Why? Well, the reasons are twofold. First, the states will eventually be forced to pay for the Medicaid expansion under Obamacare, and Medicaid will end up being stacked with people who can't afford to buy their own health insurance under the Obamacare exchange. Secondly, states will be pushed to operate the insurance exchanges under the guidelines set by the federal government. Now, here's how the guidelines work. Instead of letting the free market assign a fair price and letting consumers mix and match plans that work for them, choice, progressives are always saying choice, like letting the free market run its course, Obamacare forces consumer to buy the plans that are filled with the requirements that the government mandated. So every plan should have all the same things, basically. So it eliminates choice, which increases the cost because the government decides which options are in your best interest. If you don't want free birth control, too bad. The government thinks it's a good idea, so you just have to pay for it. This whole thing is clearly going to be a huge mess, and the Obamacare layoffs are going to make it worse. Companies are already cutting jobs and reducing workers to part-time to avoid paying their health benefits. So now those workers who are no longer getting benefits are going to put pressure on the government system for health insurance. So what do you think is going to happen when more and more people fill the health insurance exchanges? The costs are going to go up. States aren't stupid. They realize this. Now, name an area where in the economy where government intervened and the cost of a product or service went down. You're really not going to find one. Look at energy, education, housing, you name it. The list goes on and on. Avik Roy is a health policy expert, and he's been covering Obamacare for Forbes.com. He's also a senior fellow at the Manhattan Institute. Is there a cruel irony to these hospitals like the Florida Health in Orlando laying off these healthcare workers? I mean, that is decreasing supply in the healthcare industry.
Well, overall, government's going to direct even more taxpayer dollars to healthcare. So overall, the healthcare sector is going to grow. But the area where it's going to decline is in physicians. So just as the baby boomers are retiring and more people are going to get government-subsidized healthcare, baby boomer physicians are retiring. And the number of medical schools that's producing doctors stays the same. So we're going to have less doctors per capita. We're going to have a lot more people demanding care. We're going to have a lot more subsidization of the consumption of health care. And that means it's going to take a lot longer for you to get a doctor's appointment. You're going to wait in line a lot longer for critical procedures. And
you might not even get them if the IPAB says they're not worth it.
That's right. So the quality of your health care is going to go down.
So let me see if I got something right here. You're saying that it's not doctors they're laying off per se, but maybe other people who are support staff that make your stay in the hospital or your health care more effective, but there's going to be more pressure on the system. That might leave us with, let's say, redesignating physicians' assistants to do more things that doctors used to do. So fewer support staff, fewer doctors, more things being done by people who aren't really doctors. How does that increase quality?
Well, in certain areas it might, there's certain things like, monitoring your blood pressure, which a nurse might be able to do. So that's fine. But overall, you're right, that basically there are going to be a lot of things where doctors aren't going to be able to see patients. Well, what's going to happen is the government program is going to pay doctors less. So if you're on Medicaid or if you're on Medicare, you're on the Obamacare exchanges, those programs, in order to make these big promises to American voters, are going to say, we're going to cover everything, but we're just going to pay the doctors less to treat you. People on traditional private insurance will still pay doctors more. So if you're a doctor and you have the choice of what 20 patients you're going to see today, you're going to see the patients who pay you more. And that's going to be the patients on private insurance. So if you're the part of the half of America that's on government insurance, you're going to have a much tougher time getting care. If you're on private insurance, traditional private insurance, you're going to do fine. It's like public schools versus private schools, right? We all pay the taxes that pay for the public schools, but those who are wealthy enough, they send their kids to private schools and escape the system. So the real problem is going to be for all the people who can't escape the system. We're stuck in the healthcare equivalent of public schools. Well,